Welcome to the Codecast Podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast Podcast. My name is Terry Fletcher. For those of you that are new to the Codecast, welcome. And for those of you that are our loyal listeners, thank you again for all the downloads, the ratings, the reviews, the comments. We really appreciate that. I've received a lot of emails lately on some different things that are happening in the healthcare industry, and I'm going to address those today. Today's going to be actually a short segment. Next week is going to be our 50th episode, and we're almost at 12,000 listeners and downloads. And so I'm going to start on a series, two-part series on compliance manuals and compliance plans. I don't think everybody realizes that the ACA actually has a rule and a guideline that you have to have a compliance plan if you're taking any Medicare, Medicaid, or managed care plans that have to do with Medicare. So any government money, you have to have a compliance plan. And it doesn't just mean in one department, it means across the board. So I'm going to be giving you some insight for that starting next week. But this week, we are going to focus on something that I thought would be kind of fun. One of the things in the Codecast podcast, so when you podcast, you can podcast on anything. You can say whatever you want. There's really no filter except for you have to be careful of profanity, because if you put that in there, even though sometimes seems like a good opportunity, iTunes tends to say that that is not appropriate, and then they'll put you into a different category. And we are in health and careers, so we want to make sure that we stay on medical billing, health and careers, and medical for our categories. So we don't want to be in the profanity area, even though you might hear me bleep some things out when I get frustrated. But one of the things that we want to focus on when I say that is that I try to go a little bit off the grid sometimes, because we can be so, let's just say, open to discussion without fear of judgment. And so we really get into some things. Even though this is coding and billing and reimbursement and compliance, there are some topics out there that have been a little bit taboo, and I've been a little bit leery to get into them, even though they do go into healthcare definitely as a controversial topic. And one of them is navigating medical marijuana and how to deal with all of that when it comes to the difference between some of the leniency of some state laws, but they clash with some of the federal regulations. And so healthcare facilities are really dealing with a lot of drama there. The other topic is when we get into LGBTQ coding and billing and reimbursement on that end. One of the things I ran into recently was on a news program that I'm on called Talk 10 Tuesday with ICD-10 Monitor. There were a couple of speakers piping into the Talk 10 right from Florida, from the AHIMA conference. And one of the speakers had said that there was some issues talking about the population of patients because she felt like the audience needed sensitivity training first. And so for the next, week or two or three, I'm going to be getting into some of these topics just to get your feet wet in them. If you are a little bit standoffish on the topics, or if it makes you uncomfortable, there's no judgment in that. I mean, that's how you feel about it. Unfortunately, we're going to have to really learn to keep politics and feelings and things out of it. As I've said in my different platforms that I'm on, whether I'm speaking at a seminar or webinar or at a conference, I do not hide the fact of my political affiliation. And so it's interesting when I get into some of this as well, that I have to put that aside when it comes to dealing with a lot of these government programs and different patient populations. It's about compliance. It's about billing, coding, and it's about the patient. And so we're going to kind of tackle a little bit of uncharted territory here on the podcast, because you may not hear it in different venues, because everybody has to be politically correct now with how sensitive everybody is about every topic. And then in the later part of the podcast, I am going to talk about 3 of really, hopefully, some good tips for landing a medical coding job. I've had so many listeners reach out to me through either email or on LinkedIn through a direct message or through my social media accounts, either Twitter or Instagram, and said, I'm really trying to break into the field. Can you help? And I've done my best to try to address hopefully those questions and give you some insight on whether you can or can't. It's hard because one of the gals that contacted me. She had been in title insurance for 30 years and said, now I want to be a coder, but I want to retire in 3 years. So I had to handle that a little bit different. And then also, new coders that are coming in saying, hey, I just passed my exam. Now what? So I'm hoping to be able to give you some insight there, and we'll do that in the later part of the discussion on the podcast today. But first, we want to thank Advanced MD, spotlighting telemedicine as a solution that's proven to boost patient engagement and bring in new revenue streams for your practice. AdvancedMD.com. And Healthcare Executive. Healthcare Executives Network is the fastest growing community for healthcare executives and their trusted partners. HealthcareExecutiveNetwork.org. So we appreciate, our sponsors and our partnerships that we have in our Codecast. Helps keeps us on the air. And I've had a lot of actual inquiries about if you could be a sponsor or you want to be a part of our Codecast as far as a partnership. So please email me directly, either at terryfletchercpc@aol.com or at terryfletcherccc@gmail.com. We have some premium spots available, so just let me know, and we're happy to get you on board. So let's talk about medical marijuana. And I like to say, let's talk about it with eyes wide open. See what I did there? So there has to be some humor here, folks. It's now partly legal some places, not legal other places. One of my, side things that I like to do is I love NFL, as I've mentioned before, go Steelers. But it's interesting because I think that they're a little bit behind the curve as far as allowing these players that are getting their bodies beat up weekly and allowing them to use it as a form of pain relief. But in my, mind, it's still because of, I guess, how I grew up and in the, genre I'm in, I still consider it a drug. And I would not want my daughter or kids, really going in that direction, especially because it's not what your parents used to grow in the backyard anymore. It's a synthetic version of it. And if you look at any of the Colorado emergency departments or California emergency departments, really any of those states that have now allowed medical marijuana or also casual use of it, or I should say recreational use of it, there's a lot more medical issues that have been happening. So we just want to make sure that your eyes again are wide open. You're understanding that some state laws can clash with federal regulations. And healthcare facilities may be a prime intersection for this. So we just want to really talk about the different state legislations on medical and recreational marijuana and provided the framework on how employers should really write and adjust their policies regarding the substance, with the understanding that federal policy still classifies marijuana as a Schedule I controlled substance. So now that cannabis products have burst really onto the scene, hospitals and other residential care facilities are struggling with what to do when patients present with medical marijuana cards and attempt to use marijuana in their facilities. So, the healthcare providers and the facilities, they really need to update their policies and procedures really to address some of these growing concerns. So first thing, and I mentioned this before, you need to leave out your politics. Your clinicians, administrators, or other staff may have strong opinions on marijuana accessibility and legality, but you cannot let your personal opinions, emotions, or politics shape your practices, policies, and protocols for marijuana usage. Believe me, if it was up to me, I'd say no usage, because I see what it does to people. And I've actually was having a conversation with a trusted colleague recently, and he and I disagreed on the entire topic of it. I mean, disagreed to the point where it got a little heated, and he knows who he is when he listens into this, but I take it from a healthcare perspective. And so from that perspective, you really have to just put your philosophy regard aside and really look at, and also, your political or medicinal perspective, but really figure out, so our institution, how can we develop and implement a comprehensive set of policies and procedures to address the inevitable circumstance of a patient presenting with a medical marijuana ID card or cannabis products in hand? So the state in which you practice and its position on marijuana obviously is going to affect how much attention you need to pay to the substance when crafting your practice's policy. This is a good lead-in week too, since I'm going to start on compliance plans next week. And a compliance plan really is when circumstances come up in your practice where you need to have a set of guidelines that everybody follows. Otherwise, there's well-publicized disciplinary actions against the party that did not follow the protocols. Remember, compliance has to do with accountability. And if you're not being accountable for your actions or for not following the rules, then there has to be some kind of disciplinary response to those actions. I do it within, my staff, the subcontractors I use. If I'm not getting timely information, if I'm not getting things done when I need them done based on my deadlines as well, then I'm definitely taking action against that person. But when we talk about the medical marijuana situation and really understanding some of the policies that really need to be in place, I just want to look at some more localized considerations medical facilities and practices should take into account. So first of all, does the facility specialize in treating one or more of the 17 serious medical conditions that qualify a patient for medical marijuana use? So I'm going to run down these just as a brief discussion, because this isn't in every state, but these are most states, and this is really the serious condition list. So one is Lou Gehrig's disease. So it interferes with the brain's ability to communicate with muscles, gradually causing paralysis. So that's one. Autism, this refers to a range of conditions characterized by challenges of social skills. I was actually surprised this was on the list, only because autism still has so many areas of ambiguity that you're just not sure what the patient really may have. And sometimes I feel it can be a default diagnosis. Cancer, so this can stimulate the appetite, helping to offset the lack of appetite experienced with people undergoing cancer treatment, such as chemo or radiation. And so it's also for pain relief. Crohn's disease, this actually is been very effective to relax the colon and the digestive tract in people with severe inflammation in the large intestine. Damage to the nervous tissues of the spinal cord, so with objective neurological indication of what they call spasticity. So it's usually after an injury, usually a car accident. Epilepsy, this is a chronic disorder, and it can actually, the cannabis use can actually help with the unprovoked seizures. So that actually was a positive thing. Just a couple more. Glaucoma, HIV, and AIDS. Basically, again, that's more of, it can help infections stay dormant. Huntington disease, that's a fatal genetic disorder that causes the progressive breakdown of nerve cells in the brain. And then inflammatory bowel disease, very similar to GI tract Crohn's disease. Intractable seizures that can't be controlled through normal treatments or available medications. The only thing that's a hard thing for this one is that it's a lot of times intractable seizures are in children. So this is where there's a little bit of controversy in a couple states about that. MS, so multiple sclerosis. This can cause, nerves themselves to deteriorate or become permanently damaged. And so, and then neuropathy, so nerve damage, Parkinson's disease, post-traumatic stress disorder. Again, this is, a disorder that is diagnosed through conversation and interview. And there's been a little bit of payer concern that a patient can say this is what they have when there's no real traumatic event that they can tie it to. And then severe chronic or intractable pain of a neuropathic origin. And then the last one is sickle cell anemia, because that's a disease where the body produces abnormally shaped red blood cells. And they don't last as long as normal. You'll find that people that have this can't be in high altitudes as well. So because all of a sudden they can't breathe and their body contracts. So these are the 17 serious medical conditions that qualify for medical use. So make sure you are, looking them up on your web browser as well. And then, does the institution receive federal funding that could be impacted by permitting the use of medical marijuana? What is the facility's existing human resource policy on drug-free workplace? And does this policy address the use of medical marijuana by employees? And what is the facility's controlled substance diversion prevention protocol? So if your practice's policies don't address any of the aforementioned factors, then spend some time brainstorming and running risk analysis before you set your marijuana policies in stone. And then also, really talk to your employees about this, because for one state that's really proactive, it's Pennsylvania. And I was pulling up some rules on this for them. And it was basically saying under Pennsylvania Medical Marijuana Act, it's unlawful for an employer to discharge, threaten, refuse, or to hire or otherwise discriminate or retaliate against an employee solely on the basis that they're using they're certified to use medical marijuana. However, they say nothing in the law prevents an employer from disciplining an employee who is under the influence of marijuana, regardless of the source, or for working while under the influence when the employee's conduct falls below the standard normally accepted. Well, you know that employers are going to default to that, so that's why you have to be a little bit careful. And then, so the bottom line for this, for healthcare practitioners and facilities, following federal law is probably the safest when established marijuana policies that affect employees. And that's what I know a lot of the major sports affiliates do as well. And it's been controversial, but it's kept them out of federal financial penalty because it's hard to fight what the federal government says as far as this is our policy on it. So you can look at the state rules, really figure out what your state allows. There is a website at medicalmarijuana.procon.org/view.resource. Take a look at that and just see if there's something that you want to address within your practice, because it's coming. It's now coming. It's definitely something that's out there. So next, before I get too far into and get into the tips for landing a medical coding job, I would like to thank Medical Economics, Smarter Business, Better Patient Care, medicaleconomics.com for the business of medicine, digital magazine, and health IT. And make sure you see my article that's up this week in Medical Economics. So we appreciate them helping us out on our podcast. Now I'm going to do my coding question in the middle. I had a pretty successful Top 10 Tuesday last week when I gave the latter part of my Q&A segment with common abbreviations and acronyms, and what do they mean when you see them in a medical record. So I'm going to continue on that path with more, and you may have heard some of these already. You may know some of these, but these acronyms are helpful because when you see them in the record, you're like, oh, okay, now I know what they're talking about. Okay, so ACL, anterior cruciate ligament tear. So you've probably seen that if you're a sports fan at all. ALL, acute lymphoblastic leukemia. AMI, acute myocardial infarction. ARF, acute renal failure. I don't always see it called ARF, but sometimes. BKA, below the knee amputation. CA is referred to as always as cancer. BP, blood pressure. CABG, CABG, coronary artery bypass graft. COPD, chronic obstructive pulmonary disease. CVA, cerebral vascular accident. When you see C/O, that means the patient complains of. DCIS, ductal carcinoma in situ. CXR, chest x-ray. DJD, degenerative joint disease. DVT, deep vein thrombosis. FX is fracture. HA is headache. And you're going to see a lot of these in hospital records as well. They're just so quick in and out. H/O, history of. HTN, hypertension. HT, height. That's in your vitals. ICD, implantable cardioverter defibrillator. IPF, idiopathic pulmonary fibrosis. JT is joint. LBP, lower back pain. LLQ, left lower quadrant. MCL, medial collateral ligament. ORIF, open reduction and internal fixation. PCL, posterior cruciate ligament. RA, rheumatoid arthritis. RDS, respiratory distress syndrome. R/O, rule out. SOB, no, it's not what you think, is shortness of breath. S/P, status post. TKR, total knee replacement. TMJ, temporomandibular joint, that's your jaw. UTI, urinary tract infection. URI, upper respiratory infection. And WT is weight. So those are, again, just some more. Now we've probably been up to, I think we've given you 50. So just wait till next week. We're going to have more for you even. It's just crazy how many are out there. And then as I'm finishing up today, I wanted to talk about tips for landing a medical coding job. When I get these questions, it just makes me happy that anybody that listening in says, I think I want to do that, or I want to break into the field of healthcare. And I just appreciate that so much. Think about this. If the economy is good, you're going to have a job because everybody's going to have, or at least have a good start on elective insurance. They're going to be, getting procedures that they can afford the out-of-pocket or their share of cost. And you're going to see some higher salaries for healthcare professionals. The economy's terrible. They're still going to need us because when the economy's bad, people get sicker. They absolutely have to utilize their insurance, and practices are busier than they've ever been. Now, I am a professional coder, which means I code physician side. I do a little bit of outpatient facility, but all my coding experience for the past 30 years is all on the physician side. And so one thing that whenever I give a seminar or a live presentation, I ask the audience a question. I say, how many of you are coders? And they raise their hand. How many of you are billers? And they raise their hand. But it's amazing how many coders do not put their hand back up. Now, I understand if you're a biller, you may not think you're a coder. Okay, I get that. But if you're a coder, you better raise your hand in the professional side of coding, because I would think you'd like to know if you get paid, if what you're doing is appropriate and it's working for the practice in the form of reimbursement. If you are a facility coder, you may never know if anything you code or submit gets paid, because there's a bureaucracy in facility coding where basically it's going into some black hole, and then you're hopeful that nobody comes and pulls you out and says, we need to talk about your job. But in the professional side, you get to see full circle. So you just want to make sure that you are approaching landing a medical coding job the right way. And these are 3 tips, hopefully, that will help you. And hopefully you'll find these are the most important for you as well. And this is to break into the role. First of all, apply for positions in the billing department. You don't have to be certified. But one of the best things I ever did, especially because my background, not only nursing, but also with the medical field, but also in the financial end of it with my economics degree, I started in the billing department. I wanted to collect money. So I watched a lot of the externs turn down jobs in billing because they only wanted to code. But I personally see this as a mistake. By getting into a job in the billing department, you acquire very essential skills. You learn so much about the other side of the fence that really benefits you once you have the opportunity to apply for the coding position. It also buys you time to get a certification in coding. The company you're at may eventually have an opening in their coding department, and because you're already part of the company, now you have a reputation that hopefully you've built a good one and reliable one. And they may be willing to give you the chance instead of going outside the business. This was the case for a lot of colleagues that I know. And I do know people who were fortunate enough to get into coding without taking a position in billing. But you're at a serious advantage having billing experience prior to becoming a coder. And then number 2, I cannot stress enough the importance of either joining AAPC or a HEMA or a local chapter or something that is an association that focuses on healthcare certification. Networking. It is essential not only to obtain CEUs and experience in the educational presentations, but now you're going to meet other coders, you're going to build, business connections. And I don't mean this in a self-serving reason. I mean, you should really do this with other coders because other people have different experience in different specialties. And you want to make sure that you not only kind of have this great learning opportunity, but that you're building a connection so that when that job opportunity happens to open up, that person feels that they have a rapport with you. And then maybe they'll make a connection and make you an offer. And then someday you may be able to do the same for them. So don't be afraid to connect with other coders and learn from them as well. There are plenty of seasoned coders ready to take you under their wing in a mentoring program. And then last I'm going to say on this is stay current. So take webinars, go to conferences, chapter meetings, stay up to date on what's happening in the industry. Subscribing to this Codecast podcast, I applaud you for being, just proactive and smart about it, because you don't know the work it takes to make sure that I have up-to-date industry information that happened yesterday. I mean, we just want to make sure we have it so accurate for you. I've had several topics, and I just told you I'm about ready to hit my 50th episode, where I've had to scrap the topic because something changed the day after I had all my notes done. And so you really need to stay ahead of the game if you want to be a major league player in healthcare, especially in an executive, coding, billing, higher position. And eventually, I would think some of you might want to take it into consulting. So things change all the time. And if you are smart enough to keep your knowledge up to date, You're already putting yourself in a position to separate yourself from other candidates. And there's many things nobody tells you about your first coding job once you've landed it. So you will be terrified to make mistakes. You might feel like you're appearing foolish to ask certain questions, but making mistakes and appearing foolish or looking green will happen to you. Making mistakes means at least you're trying, and there are also teachable moments for you as you grow as a coder. So never be afraid to make a mistake. Just learn to correct that mistake and take it as an educational opportunity for yourself going forward. Never take it personally, recover well, take ownership of your errors, and use them, make yourself a better coder. That is the goal after all. So you want to make sure that you do that. I hope this helps with getting you started on your career path when it comes to being a coder or biller, and that you find that your opportunities are just around the corner. And before I wrap it up for today, I'd like to recognize our proud partners of the Codecast podcast. It's part of our Giving Back and Making a Difference campaign. 4 Oceans, for every bracelet purchased, funds removal of 1 pound of trash from the ocean. So 4ocean.com. And Pro Literacy, helping to raise adult literacy rates to improve lives worldwide. proliteracy.org.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.